Okay, let's discuss about visual acuity notation and pinhole visual acuity. This is part 9. I think it will go up to part 15. I don't know. So let's start. So basically, see, you have to understand what is visual acuity and how we'll go for the notation. So many times visual acuity means monocular vision, isn't it? Sometimes we use binocular vision. Let's take an example for refractive surgery. We use binocular vision as for the reference, and we sometimes we use example like monocular contact lens for near, right? Okay, so in that case we try to do check vision binocularly, otherwise we check vision monocularly. It's always an examination distance, which is crucial. It's you have to mention examination distance, and we sometimes do not consider examination distance for distance, because distance means it's to 6 meters or 20 feet. But in case of intermediate and near, you have to mention distance. For example, visual acuity is n10 at 50 centimeters or whatever. Okay, and you have to mention whether it is corrected or uncorrected. And some fancy way of saying corrected is CC, which is com corrected, or fancy way of saying uncorrected is SC, which is sine corrected. That is Latin word. Okay, that's important to understand. And sometimes we use to like with PG, present class, whatever. This is the way with contact lens. So we used to write in techniques, but you have to understand this is important. Okay, so some abbreviations we use, so something like UDVA, uncorrected distance visual acuity, UIVA, uncorrected intermediate visual, UNVA, uncorrected near visual acuity, CDVA, corrected distance visual acuity, something like that. Just pause the video and read all these things. Okay, so let's move towards the pinhole visual acuity. I have already made one video 3 years back about pinhole visual acuity. You can watch that video too, but let's just move in this visual acuity series. And this pinhole visual acuity, what is pinhole? Pinhole basically means is eye shield allow a view through small aperture, and we use 1.20 is approximately standard. It's not strict, but yes, 1.20 is good diameter of the 1.20 mm is a good diameter of the pinhole actually. So this is the multiple pinhole, this is single pinhole. You can see a lot of single pinhole in trial uh, frame. Okay, and you see this type of pinhole in low vision clinic and all these things. Okay, so what pinhole does? So basically, pinhole works on the principle of pinhole do not work on the principle of Stiles Crawford principle of God. Just it's not that. Pinhole works based of principle that decreasing the size of blur circle on the retina. That's correct. Okay, it's not Stiles Crawford effect 1 or 2. Just stop. That's not okay. Pinhole only do reduction of blur circle, size of the blur circle on the retina. And whenever blur circle size is reduced, it means sharper focus, it means visual acuity increases. Okay, so small pinhole reduces retinal illumination, isn't it? Because what is retinal illumination Troland? The chart illumination in candela per meter square, that is neat into area of pupil, yeah, entrance pupil. Area decreases, isn't it? 1.2 mm diameter means pi r means 0.6 whole square. Just do that. It reduces. That's why retinal illumination also reduces. You know how to calculate true land, isn't it? I have shown you true land TD. Okay, you can calculate by yourself. And another thing, whenever size of the pupil decreases by the means of pupil or by means of pinhole, one of the fantastic thing happens is increasing depth of focus or depth of field. Obviously, if in retina this depth of focus, in field it's depth of field. Okay, so let's make a discussion about things clearly. Whenever we decrease the size of pinhole, whenever we decrease the size of pupil, what happens? We have to just balance things. It's not about just reducing the size of pinhole and then everything goes fantastic. Okay, it's not that. Okay, first, if the smaller the pinhole associate, then we know diffraction effects leading to decrease in visual acuity. one of the disadvantages. That's why we stop in 1.2, isn't it? Even we can go below and below. After 1 mm, there is high chance of reduction of vision. The reason is diffraction. And at the same time, Gaussian propagation, the smaller pinhole results in increasing size of the blur circle list, confusion, and decreasing vision. Because when you go smaller and smaller, then circle of list confusion size increases, which means basically decreasing the vision. So that's why we do not move so small. And another, depth of focus, as I have already told, increase the depth of focus, which also tolerate the refractive error. And another things, if you go smaller, then reduces the aberration, which has chance of increasing visual acuity. That's why it's a sweet balance approximately at 1.2 mm. But you have to understand, it's whenever you decrease the size of the pinhole, it's not always going to be a good thing. Okay, you have to consider about diffraction, you have to consider our depth of focus, you have to consider our aberration, and all these things, Gaussian propagation. Okay, it's really important to consider everything. And now, therefore, the proper pinhole aperture diameter is chosen 1.2 mm. Sometimes, many times you see in MCQs, just try to understand 1.2 mm is good choice. Okay, to balance this counter effect, and the size is effective for the refractive up to 5 diameter. Just if you are my student, I want to tell you clearly that don't ever think that you put pinhole and there will be 6 6. No, even if it is 2 diopter hyperopic or myopic, whatever, don't consider it. Just consider one thing: if uncorrected visual acuity is 636, whether it's improved or not. Because if it is not improving, then you can consider, like for example, media opacity or retinal problem or neural problem or anything else. If it is improving, then there is a chance of improvement with the correction of refractive error. So that's just a point. It's not about 6 6, or it's not about 6 4, or it's not about 6 9. Whether it's improving or not, if it is improving, there is a chance. And we will think later on, by doing refraction, by doing contact lens trial, by doing scleral lens, there are a lot of things we can do. But pinhole is just a diagnostic test. A little bit it gives hints, and it will protect your time. So that's the pinhole. But pinhole, you have to understand these many variables. It's not like straightforward. Pinhole means I just put in front of eye and whether vision is improve or not. You have to consider a lot of things, and you have to think as like a good optometrist who can understand things in optics. Okay, it's this. So up to 5 diopter you can expect, but like example -10 diopter, you cannot expect a lot from pinhole. Yes, you can just guess a lot, little bit, that vision is whether improving a lot, a little bit, just that's all. Okay, just don't expect too much. So it's about notation. You have to understand what is visual acuity, cum correcte, or sine correcte without correction, cum correction with PG, and all these things, and whether we use monocular or whether you use binocular, and all these things. Second, pinhole visual acuity. You have to understand what is pinhole, what is 1.2 mm, and what is the balance between diffraction, aberration, depth of focus, and a lot of things. So you have to understand pinhole as a whole, not just pinhole. I have to put it and there will be magic. No, that's not going to happen. Okay. So finally, as always, one of my favorite authors is Professor Dr. George Mary's Visual Optics book. This is the reference. Okay, Bistan, choose.